Bud, and public health nurse Cindy Wolfinger. Nice to have you here.
Nice to be here.
Thanks for having us.
Yeah.
And we invited these folks here because it is a special month. We're observing, what month is it?
It is nationally known as SIDS Awareness Month, so
Okay.
Sudden Infant Death Syndrome. Here in Michigan, it is this year. It's Infant Safe Sleep Awareness Month.
So, in your notes preparing for this interview, I saw a staggering statistic, and that is, in Michigan, a baby dies every 3 days due to unsafe sleep.
Yes. So if you look at that a little differently, that's 6 to 8 kindergarten classes every year.
Okay, that's sickening when you think
yeah.
about it like that.
So
Oh my God.
nationally, it's about 3,500 babies
Wow.
every year.
So, what is unsafe sleep? What leads to this?
Yeah, so SIDS itself is just the unexpected death of any infant under the age of 1 year. Often it's due to an unknown reason that they die. They're typically a healthy child that just passes away suddenly. The American Academy of Pediatrics has recognized that if we can increase the safety of the sleep environment for the infant, that often will reduce the risk of SIDS. So with that, they do recommend lots of different things. They recommend that you do place your baby alone on their back in a crib. You want to make sure that is a flat sleep surface. No inclined sleepers, such as like a swing or a bouncer or anything like that. Making sure that your crib has just a tightly fitted sheet on it. You want to make sure that there's nothing else in the crib with them. So, none of those bumpers, no cute stuffed animals, no extra blankets, pillows, anything like that. If you're worried that your baby's going to be cold, you can dress them in some nice kind of footy pajamas, or like this picture shows, a nice sleep sack. Here you have an infant that's in a swaddle sleep sack. And these are really great, especially for newborns. You do want to make sure that you take your infant out of these when they start to roll, so around 3 to 4 months typically. Also, the American Academy of Pediatrics recommends that you do keep baby sleep space where you can see them and hear them, but not in your bed.
Yeah.
So sharing your room with them, but not your bed. So this mom demonstrates it great. She's got that nice bedside bassinet for the baby.
I bet when the photographer left, she put the baby right in the bed.
Hopefully not. Hopefully not.
So it's scary and tricky for new parents.
Oh.
You have a baby, and then sometimes a day later you're back home. So yeah, I think a lot of people, if you don't know any better, you would probably put a little blanket or a little toy in there. It's just something you always have to be aware of.
Definitely, and it is a terrifying thing. I do this for a living, and I myself have a 4-month-old now, and it's horrifying every night when we go to sleep.
I think parents have a tendency to over check maybe right before they go to sleep anyways, but yeah, it's scary because you hear all these stories. And it's absolutely amazing. What if people need help? They have some questions. What do they do?
Well, so if people come to me with questions, I answer what I can. And then I look to Cindy.
Expert.
I go to the expert here at the health department, absolutely. And there are a lot of questions, especially with those infants. Unfortunately, Jackson County Health Department is really lucky. We have a lot of programs. So not only do we have Cindy to talk about safe sleep and what happens for those bereavements if something does go wrong for our families, but we also have supportive services as well with our maternal infant health programs, children's special health care services for children with medical diagnoses, early on intervention for people that need a little bit more support for cognitive development and physical development, and of course our immunizations clinic in WIC.
And it is scary. You said you have a baby, and Matt, you're a newlywed. Any kids yet?
No kids.
So that is, you check, you're putting your finger under the baby's nose, you're looking to see if the chest is going.
I think I did that until my daughter was like 6 or 7.
Yeah.
To be honest.
I believe it.
But people, and I think there's just because we don't know so much about what the cause of SIDS is, the way you put a baby to sleep, on their side, on their back, on their stomach, and what happens if they change position in the middle of the night. It's like, are there answers to these questions?
So unfortunately, no as to what causes it. There was a study done that they think they found maybe a different hormone that's causing it, but the study isn't big enough to say for sure. So a lot of unanswered questions still, but they are recommending that you do put the baby down to sleep on their back. A lot of parents are worried about choking and that they're gonna maybe spit up in their sleep and choke on their back, but gravity actually helps protect the airway in that situation. So they're more likely to choke if you do put them on their belly to sleep.
Do you recommend, or well, I'll ask you if I'm sure you have a monitor. Do you go in and move your baby from time to time?
So I did the first time she rolled over. So once they are able to roll themselves, you don't have to roll them back over onto their back. They do still recommend that you put baby to sleep on their back, but once they can roll themselves. But she decided to roll for the first time in her sleep, so I did reposition her.
And no baby, no bottles, nothing like that.
Correct. No. Yeah.
Because
So
that
no
could be
bottles in bed.
contributing.
And that's probably a lot different than, say when I was a baby or
Oh
when
my
you
gosh,
guys
we
were
put
baby.
so much stuff in the crib, and there were bumpers all along the thing.
Yeah.
And mobiles hanging down.
Yeah.
A fishing pole. I mean, there was so much in your. It's amazing, but we've learned a lot.
We
since-
have learned, we've learned a lot, and things like car seat prevention. I know that's a big thing. The fire department's working on that as well, and something like that changes all the time as well. So being a new parent, it's constantly throwing changes in ways to care for your child.
Yep.
At what age is the danger of SIDS evaporate?
1 year.
1 year.
So that's our magic number.
It really is a staggering statistic.
It is. Yeah, it's amazing.
And,
The babies under 4 months of age are at the highest risk for a SIDS death, but that doesn't go away completely until about a year.
well, while we have you here, the FDA authorized boosters now for kids 5 to 12. The booster's available as a reformulated booster, and you are able to provide that at the health department.
Absolutely. We're recommending people come in for both the COVID-19 booster, our primary vaccine if they haven't received it yet, or the flu vaccine. It's that season. We're going inside more, gathering here with our families. So trying to keep yourself and your family safe. Those vaccines are probably the best tools we have.
And it's a walk-in clinic 4 days a week.
Absolutely. Call ahead just in case, because appointments are a little bit better than walking in sometimes. Sometimes we get busy with our walk-in clinics, but we are available Monday, Tuesday, Thursday, Friday, most weeks.
You can get both the flu vaccine and the COVID booster at the same time.
Yes, you can. And I recommend it. That way you don't have to make 2 trips.
Well, great to have you guys here and share the information about keeping our babies safe.
Thank you so much for having us and helping us spread the word.
Thank you.
Thanks.
From the Jackson County Health Department, Deputy Health Officer Matthew Budd and Public Health Nurse Cindy Wolfinger. More in the morning show right after this.